Gout is a condition characterized by a sudden onset of severe pain to your joints. Fortunately, gout is treatable and recurrent attacks are preventable with lifestyle changes and medication. Want to learn more about gout? Keep watching as we will break it down here. My name is Dr. Jaunbocus. In this series, we will review medical conditions affecting our bones, muscles, and joints. At JHP Medical, we make weekly information videos designed to increase awareness and help you better understand your medical condition. So, if you find this video helpful, subscribe, click the notification bell and the like button to support us in helping you. Okay, so what is gout? Gout develops due to high levels of uric acid in your blood. Doctors call this hyperuricemia. A patient may have high levels of uric acid for many years before developing the symptoms of gout. Patients may experience recurrent flares of symptoms, often with periods of complete resolution between attacks. After several years, patients may develop chronic tophus gout. Here, permanent crystal deposits form within the soft tissues and joints. Who gets gout? Gout is the most common cause of inflammatory arthritis worldwide. It is estimated to affect around 6.8% of the population at any one time. The condition is more than 4 times more common in males than females. The prevalence of gout also increases as we age. Initial presentation is usually between the age of 40 and 60 years old. Relatively few individuals experience the condition below the age of 20. Gout also appears to run in families, meaning if you have an affected family member, you will be at an increased risk for developing this condition. The high levels of uric acid that causes gout is caused by a disorder in purine metabolism. Therefore, individuals consuming high purine foods are at increased risk. The foods high in purines are red meat, meat organs, seafood, food and drinks high in fructose and alcohol. Certain medication can also increase your risk of gout, including diuretic medication, also known as water tablets, ACE inhibitors, medication commonly used to control your blood pressure, and aspirin. The following medical condition also place you at an increased risk: postmenopausal woman, being overweight, high cholesterol, the presence of abnormally high blood fats, high blood pressure, those who suffer from diabetes or prediabetes, kidney disease, and metabolic disorders. So, what are the symptoms of gout? Gout presents as a sudden onset of severe pain affecting one joint. Symptoms may develop overnight, peaking within 24 hours. Individuals experience severe pain, swelling, redness, and warmth of the affected joints. The first affected joint is classically the base of the big toe, reported in more than 75% of new patients. However, gout can affect any joint in the body. Ankles, knees, elbows, wrists, and fingers are more commonly affected. Fortunately, flares of gout resolve within 1 to 2 weeks. Recurrent flares, however, are common. Patients with a long history may experience complications of high uric acid levels. Some may develop painful urinary stone associated with loin pains. Deposit of gout in the skin, called gouty tophi, affect around 50% of patients 10 years after diagnosis. How will my doctor diagnose gout? Your doctor will review your presenting history, establish any risk factors for gout, and perform a clinical examination. Usually during an acute flare, no further investigations will be required. The most accurate diagnostic test for gout is to obtain a fluid or tissue sample from the affected area. These samples can be analyzed in the lab under the microscope, assessing for the presence of uric acid crystals. Obtaining samples is not always practical. Therefore, this test is usually reserved for cases where the cause of joint swelling is uncertain. 6 weeks following an acute attack, your doctor may request a blood test to assess your uric acid levels. This blood test, unfortunately, is not diagnostic in acute attacks of gout. This is because uric acid level may fall during acute flares. For the worst affected joints, your doctor may request X-rays. Imaging permits assessment for joint deterioration. So what about treatment? Flares of gout require a combination of self-care and medication. It's advisable to rest, elevate, and use ice packs on the affected joint to alleviate your symptoms. Non-steroidal anti-inflammatory medications such as naproxen are used as the first line in the medical management of acute gout flares. Sometimes your doctor will prescribe a PPI medication alongside these anti-inflammatory medications for gastroprotection. This is because NSAIDs can irritate the lining of your stomach. For those unable to take NSAIDs, an alternative medication is prescribed, which is colchicine. In addition to NSAIDs or colchicine, additional paracetamol can aid pain management. For individuals with a confirmed diagnosis of gout affecting a single joint, your doctor may consider local treatment with a corticosteroid injection. In cases where NSAIDs or colchicine aren't well tolerated and local steroid injection is not an option, your doctor can prescribe a short course of oral steroids or provide a single corticosteroid injection into your muscles. Prevention. Preventing future flares of gout is possible through both lifestyle changes and medications. Lifestyle changes. Choosing a healthier lifestyle isn't always easy and requires commitment from the individual. Maintaining a healthy diet is important and is advisable to limit your intake of purine-rich food, including meat and seafood, sugar, sweetened drinks, and alcohol. Reduce your intake of processed food, consume plenty of fresh fruit and vegetables, drink between 1.5 to 2 liters of fluid per day. This can include coffee and teas. Taking regular exercise supports weight loss and promotes cardiovascular health, and stopping smoking. Uric acid lowering medication reduces your risk of developing flares of gout. Medication should be offered to all individuals with a formal diagnosis of gout. Available medications include allopurinol, used as the first-line preventative, and febuxostat. Some individuals may experience a secondary flare of gout when commencing these medications. Therefore, you may be prescribed an additional course of colchicine as a preventative. Usually, once you have been started on allopurinol or febuxostat, you will remain on these lifelong. Prognosis. Fortunately, flares of gout will subside even without active treatment, usually after 1 to 2 weeks. Recurrences are common, so commitment to lifestyle modification, including dietary changes and medications, are important. I hope you have enjoyed this video. Do not forget to subscribe and interact by giving us a thumbs up or leaving a comment below. This supports the growth of our channel and helps educate many more people about the medical conditions. Of course, this video does not provide individual medical advice and is intended for informational purposes only. Do not consider this as a substitute for professional medical advice, diagnosis, or treatment. Please do not ignore professional medical advice in seeking treatment because of something you have heard here. If you believe you may have a medical emergency, immediately call your doctor or the ambulance service. Thank you for watching. See you next time. Fireworks, yeah.